So before we get started on this video on the 5 things you should get from your continuing education courses, what every CEU course should have baked into it, get to the link up above and subscribe to this YouTube page so you get all of our videos and notice of when we are dropping new information. So let's get started on the 5 things you should get from your continuing education courses as a physical therapist, as an athletic trainer, as a chiropractor, as a massage therapist. Here's what you should get. Number 1, you should be learning how to apply science. You shouldn't need to learn any more new science because physiology hasn't changed recently and it's not going to change in the near future. From the beginning of your career to the end of your career, the likelihood of humans evolving and physiology changing is probably 0. So you should be learning how to apply everything you already learned. How to apply neuroscience, how to apply biomechanics, how anatomy figures into what you are doing. If you don't know how to apply the science that you've already learned, then what are you actually using in the clinic? Number 2, you should be attacking function. You are a medical practitioner, you have patients that are coming to see you. You should be getting them back to normal, full function, not chasing symptoms, not trying to worry about make them feel better, not getting rid of swelling, not increasing their short-term passive range of motion. Attack function, and the only way you can attack function is to assess function. If you are assessing symptoms, your treatment will rely on nothing but symptom modification. Number 3, the big picture. Do not ever take a continuing education course for shoulder or for knee or for feet or for trunk. They all work together. If you're not going to learn how they all work together, you are not going to have long-term functional gains with any of them. Your courses should be teaching you what relevance foot range of motion, loading, pronation, supination, foot function has on the lumbar spine. If they're not doing that, you will never get anybody's lumbar spine to function normally. Number 4, they should be giving you proof that you are going to get immediate and lasting functional effects with what they are teaching you. So they should be able to say, let me show you how this works. So when I teach my continuing education courses, I put my students on the table, I screen them, I show them exercise, and when they get done with whatever I'm demoing on them, they can say, wow, that made a big difference. It should not take you weeks of going and practicing something in the clinic to start seeing results. If that is true, you're probably focusing on symptoms. If you're focusing on using science as your base, and you're using scientific principles, neurophysiology, anatomy, biomechanics, once again, you should be getting results within seconds with what they are teaching you in your continuing education courses. And the last one, you should have continued support. When I teach my courses, my students come in, they've already got several months of video information, of demos that I've sent them, of information that we've gone through. So when they come in, they can hit the ground running with what we are going to do on lab weekend. When they leave, I tell them, I hope you retain 50% of what you learned in our screening, in our manual therapy, in our assessment, in our progression of exercise. If you can maintain 50% of that and get really good at that, then you can go back and remember the rest of it. But if you try to do that on your own, you're going to fail. If you're going to go through our course, through the membership, through lab weekend, and go back to a conventional medical model PT clinic with 4 other PTs that are doing symptom modification gimmicks, guess what? You're going to start sliding backwards. You need the continued support. So that's why we stay in contact with all of our students for several months after lab weekend so they can come back and ask questions. This happened, that happened, what do I do? What happens if this happens? I forgot what you said about this. You're not going to remember everything that we learn on the 2.5 days of lab weekend because it is a ton of information. So the only way you're going to move forward with that, be able to apply it and get results, is for me to continue to work with you and for you to continue to work with our community that is built into the membership. So If you're going to take a continuing education course and they give you a little manual about how to do the 5 exercises for shoulders and the 4 stretches for knees, and it's not based on science, and you don't have any support afterwards, you're probably not going to get anywhere. And if you're going to learn body part CEUs, take body part CEUs, you're probably not going to need support anyway, because you can just look in your manual and it's going to tell you what to do, because it's cookie cutter protocol thought process. If you're going to use critical thinking and get down to root cause analysis, I cannot give you protocols. I cannot give you a cookie cutter. That's why you're going to have to stay active with the community, which is what I give to our students. So those are the 5 things that you need to look at when you are looking at continuing education courses. 1, make sure it's science-based and it's teaching you how to apply the science that you've already learned in the 7 years of school that you went through. Number 2, always assess function so you can attack function. That's why your patients are coming to see you, not because they have pain. Number 3, big picture. Everything works together. If they're not teaching you how to put the entire kinetic matrix together, it's going to fall apart and you're going to fall back to symptom modification. Number 4, make sure you can prove your work immediately. They should be able to say, here's what I'm going to teach you, here's how it works, see how that works. And the last one, make sure you have continued support, a community, a mentor that's going to continue to teach you how to apply what you learned. Hit me up if you have any questions. If you're ready to change your career in less than 5 months, join the membership. I will go through all of that stuff in our video modules, our lab weekend, and teach you how to reinvent your career and become the professional that you've always wanted to be in less than 5 months.